So what you see up on the screen right now is the language from Senate Bill 2206 as it relates to the study. Now, Senate Bill 2206, as you know, also created the pilot, which is the financing formula that's being used this biennium to fund social services, but there's also the study. So the pilot, don't confuse the pilot with the study. The pilot is the financing. The study is really the work that's ongoing. And if you look through each one of those dot points that are on there, you'll notice that it's all kind of objective, math-related questions. It's all about, you know, caseload standards, consolidation, look at state employment, nothing about what we really do. So at the end of the day, this was all about how do we best get efficiencies from a math perspective. But what this didn't talk about was how do we deliver better social services. And so we really haven't necessarily been doing what the bill has asked us to do. As a side note, we just met with legislative management and council, and as I've been going through this and talking to legislators, I'm saying, we're not really doing what you asked us to do. And they'll say, well, we like what you're doing, keep doing what you're doing. But our legislative council representative said, well, the bill says what the bill says, so you better do what's in the bill. So just as a side note, I'm not quite sure how we'll manage that. So you'll notice that there's still a lot of ambiguity as we go through this. So as I mentioned earlier, the really is how do we deliver social services more effectively and efficiently across North Dakota. And what we're trying to do is let's just remove the boundaries that exist, whether they be geographic boundaries, political boundaries, and cultural boundaries, and really put the client in the middle of everything that we do. What does the client need? What does the child need? What does the family need? And if you think about social services, and you know this far better than I do, but social services are really on the front end of our whole system. And we need to do our best to get access to services as soon and as quickly as possible and efficiently as possible, and so that clients understand what is going on instead of allowing them to go deeper into the system. So when, as an example, when someone says, what are we going to do to reduce our Medicaid caseload, the number of people on Medicaid in the state, it's not that we change eligibility criteria, it's that we do a better job on the front end of social services in order to help them find food, housing, and employment. And employment not because that gets them health insurance or paying taxes. It's more from the standpoint of that's their psychosocial network. When you don't have a job, you have behavioral health issues that are likely to happen. Because if you look around, some of you work together. I'm guessing most of you enjoy who you work with. Some of you, I'm sure there's a couple in here like, I don't like working with him or her. But as a side note, if you think about what we get from our employment is the professional friendships that make us feel good about what we do. And then really there's three stakeholders. There's the clients that we serve, there's the taxpayers, and then there's the employees themselves. How do we best manage those three things as we go through this social service redesign in order to improve in those three areas? Now, it may not be that we improve all three of those at the same time. There's obviously going to be balances that need to occur, but really those are the three key stakeholders as we look at social service redesign. Now, there's some things that are ongoing that are influencing all of this. One is a new IT system that isn't necessarily meeting all of our needs. And how do we go about still doing that work, recognizing it is better, but that program is, and that system is being built on the way we used to deliver social services. So it isn't going to be perfect out of the gate. In a perfect world, we would redesign social services and then design the IT system around the redesign. Unfortunately, the IT program was already ongoing, and we will continue to move that forward. But it may not work exactly the way social services are delivered. A big thing is culture. We're doing a lot of work around culture in DHS, but I would say the other thing is there is a cultural issue that does exist between counties, region, and state. And just call it out in the room, a lot of times it's, well, that's the state's fault, or that's the county's fault. The county's not getting their job done. They're not doing this right. Well, the state didn't offer any training. How are we supposed to know how to do it? How do we kind of, as best we can, put those things aside moving forward? And then there are those general ongoing disagreements that occur, I would say, around things like foster care eligibility, and then who's responsible to pay for a mistake that's made. I find we spend a lot of time dealing with things that if we had a more efficient process, we wouldn't be talking about, okay, the county's got to pay because they determined eligibility incorrect, but I mean, now through the formula, where is the county going to get the money to make up the difference for that eligibility determination that may have been done incorrectly? So with that, we've been working since really, I'd say, July of last year, going through how do we redesign social services. And really the focus has been on how do we look at this from a client perspective? What does the client need? And there's been 4 teams that have been put together that have representation from the counties, from the region, and the state. There's 1 team on children and family services, 1 on economic assistance, 1 on adult, and then finally administration. Administration hasn't been doing as much because really the desire has been, what does CFS want social services to look like in their area? What does adults want it to look like? And we're working through that. But I would tell you there's not a lot of, even at this point, there still is not a lot of meat on what that looks from a structure perspective. It's more about setting the vision and the culture on how we need to do what we do. I mean, you can't just change that overnight. So with that, this is the APHSA model. A lot of times you'll hear people talk about we need to do population health. It's kind of the buzzword in the managed Medicaid world, as well as it is in the healthcare world. As a side note, when I worked for CHI, I was a regional strategy person, but I had my portfolio nationally was around social determinants of health. And so what I would tell you is healthcare providers are really trying to figure out how to do population health. And so what CHI did is we went into Kentucky, which 30% of their population's on Medicaid. In North Dakota, it's 12%. Much higher levels of poverty, much higher levels of foster care and other, social ills that haven't been addressed. Well, what CHI did is said, well, how do we partner with social services to reduce ER visits and to improve prenatal care and do those type of things? And I'll say this in a strange way, unfortunately for CHI, we were very successful because at the end of the day, we reduced ER visits, we reduced infant mortality, all of the things that we were focused on doing, but it hurt the health system because the health system no longer was getting revenue coming through the ER. So to try to figure out this whole population health model is not easy, but one of the things that excites me about being in the role I'm in now and working with all of you is we can really get on that front end and make a difference in the communities we serve. Because right now, if you look in that bottom left-hand corner, we are really good at following regulations. We check the boxes, we do what the feds tell us to do, we do what the state tell us to do, and we follow the rules. But at the end of the day, we don't always, I would argue we don't always see the client in the middle. And so, and I know some of you would say, no, I know my clients by name, but when you see someone, are you feeling like you can do the right thing for that child or that family every time, or do you say, I have to go through this process first before I can help you? And obviously that won't go away, but how do we start to think about that differently? And if you move up this chain, then it's like, how do we have a collaborative business model? So when I'm talking right now, I'm talking about all of us exist in this regulated business model. But as we go out, when we talk about collaborative, that's when we start working with juvenile justice, for instance. They would be somewhat outside of this. How do we work with the healthcare systems? They're outside of this. How do we have a more collaborative way of working together? Because right now, whether we like it or not, all of us in this room are in that orange box. And then how do we keep moving out so that we can eventually get to that generative level where we're actually doing population health. We're actually targeting folks on the front end who need assistance before they stay in a state where they continually have issues that aren't addressed and go deeper into the system. Make sense? Yeah, okay. Just want to go through what the Children and Family Service Committee have been talking about. Like I said, there's 4 committees. We'll just go through this one to kind of give you a flavor of where we are. So all of you know this. These are the programs and services within CFS that are being discussed. And they all have, you know, a different role within DHS, a different role within the region, and a different role within the county, and how do all of those things work together. The goals that have been created by this subgroup is, how do we build an agency that's more agile? So as an example, for me it's been a great learning experience, but there was a case where there were 3 girls who were in permanency hearings ready to be adopted, and the adoption fell apart. They were going to go back to the foster home. The whole thing blew up, and it was, you know, a county, a region, a state, and tribal issue. And then by the time it got to the governor's office, I mean, then it was like, okay, what are we doing about this? And I was like, well, let's just get the 3 girls back together, and then we can figure out what to do from there. And then someone said, well, Chris, they haven't been together for the last 14 months. And it's like, we let this happen for 14 months. And it's not that anybody at the county, it's not that anybody at the state, it's not any one person's fault. It's the process that we take these things through to make sure that we check the box, or to make sure that we're not breaking the law in order to move these things forward. It wasn't, let's all work together to get these 3 girls back together. And that's really what we want to be able to do. Deliver consistent practices across counties. I think not only do we have kind of 46 counties delivering social services, we have 8 regions, and you multiply those out, we're doing it multiple different ways. And again, it's not the people, it's the processes that we put in place. I've already talked about culture within, but then there's even the culture of how we think about children and families. I'll talk more about this later as well, but how do we move away from a risk-adverse social service delivery system to a risk-informed? So if we all want to continue to make sure that we can all get C's and D's, it's kind of like when you take a test. You know, for those who took standardized tests, if you answer a question, you get it right, you get 2 points. If you don't answer it, you get 1 point, and if you answer it wrong, you get 0 points. So a lot of times we've set this system up so that, well, at least I got 1 point. I didn't get 2 points, and I don't want to take the risk of getting 2, because then I'll get a 0 if I'm wrong. So how do we rebuild a culture of how do we try to do the best thing we can for children and families, recognizing that sometimes bad things happen? Through this, we're trying to identify and supply adequate resources, and I would say those adequate resources are more, how do we do things more on the front end? How do we focus on reunification? How do we focus on family preservation and really working with the children and the family to make sure that that child doesn't end up in foster care? Shifting appropriate authority to the delivery level. Right now, without getting into specific examples, from my perspective, we have trained individuals who are then supervised, and then maybe supervised again. And we really need to let people who know the families best be able to make the decision. And whatever is a reasonable standard for making that decision, we need to do it. It can't be, okay, I think we can do this, but I got to check, fill out the paperwork, someone reviews it, and then it gets sent up, and then it gets reviewed. How do we do, I mean, that gets into the agility as well as, you know, shifting the appropriate authority. Those 2 things are very closely tied together. We need to build a plan on workforce development, but until we know the roles that we need, we can't really build that plan. And then ultimately build a foundation to address poverty. And I'm going to talk a little bit later about an individual who's coming in from Utah. But Utah has done an excellent job at focusing on intergenerational poverty. So as we build this foundation, we can then build on this foundation to say, okay, these are the families that have been in poverty generation after generation. We can't keep doing things the same way and think we're going to get a different result with these families. So what are we going to do differently? And using this as a foundation, we may have different programs and services based on the families that we serve. Barriers to success. So think there's different caseload and workload standards that exist across the state. And there's some caseworkers who have a far greater caseload who can't keep up than in other counties and in other regions for that matter. How do we best balance that across the state? The counties don't all have the same population. The counties don't have the same ability to attract workforce. How do we look at this from a perspective, and how do we best serve all citizens in North Dakota as it relates to this work? We still have work to do around assessment tools for placements, and that still gets back even into that cultural question about, are we risk adverse or risk informed? How do we make the best decision for that child and that family? Already really talked about resources at every access point. Again, we can't have these boundaries that exist. It has to be on where the client lives. How do we get to the clients themselves? Lots of discussion about there's a lack of education and training available, and that even as we go through the DHS budgeting process, how do we continue to invest in employees and move this forward as it relates to these things? Now, that all being said, my personal opinion is the processes are so complicated that you need to do training for them. If we set processes up in such a way that needed less training, that you weren't able to make mistakes, we wouldn't need to do as much training. People would just be able to do their job and take care of those children and families instead of, okay, I need to understand how this form works, I need to do this form before this form, I need to understand this best practice, instead of saying, here's the model, go out and do good work. You know, it's, again, I compare a lot of things to healthcare because that's what I know. But I mean, you know, to put in an electronic health record with all these workflows, it takes, I want to say, if you're a nurse caregiver, you've got probably 20 hours of training total. And because you do it all the time, you're done and you're good to go. Where it seems like within social services, there's new things, new trainings, very complex processes, and then you don't do it enough, so then you have to go back and get trained again. We can't keep doing things. I mean, those who are caring for children and families need to spend time with clients, not in training and doing paperwork. Kind of already talked about resources don't exist for early intervention and prevention, but we have resources now. How do we just best allocate them? Where do we move them where they need to move? And I think that's really part of where this social service redesign is at as well. Decision-making, approval process, we already talked about that earlier. I mean, the goal is, how do we make that decision-making, allow that to happen as close to the client as possible and not have levels of supervision? Already talked about technology, culture, and then finally, the overall CFS model is broken. Those aren't my words. Those are the words that the CFS team came up with. But it's not broken because of the people. It's broken just on how it's evolved over time. Again, it's risk adverse, it's sometimes punitive. How do we think about doing what's best for the family? So, implementation. So these are some of the things that have been discussed. There's not a structure that exists for these things. There's not like, we're all going to be state employees. It's not, we're not there yet. But these are the things based on what this team has talked about that they think makes sense. So, you know, unitize. So that's what's happening in IT at the state right now. The larger agencies all had their own IT function, and then there was a statewide IT function. How do we all work together as one IT? And so we're saying it's not a centralization, but it's how do we all work as one as it relates to IT. Same thing with subsidized adoption and licensing. So the other thing when you think about this, so let's just for instance say subadopt becomes a state function. That does not mean it happens out of Bismarck. It means it happens where those subsidized adoptions are. So if the majority of subsidized adoptions are on the east side of the state, maybe that's where that function exists, and maybe there's another one in the central part of the state. It's not everything is in Bismarck. It's where do the clients live, where can we get the workforce, how can we make sure we can get to where everybody is in a timely, effective, and efficient manner. Foster care recruitment, same thing, they talked about a statewide model. Looking at, especially with the Family First legislation that's out, how do we start to work on getting on the front end? Because, I mean, the timing is right. I mean, now is the time that the federal government is saying, you need to, we are not going to reimburse on the back end anymore. We're going to reimburse on the front end. So, meaning early intervention, prevention, substance use, mental health, they will start to reimburse for those things that we've always asked for. But do we have the right structure and roles in place to be able to move in that direction? And how do we move in that direction in a consistent way across the state? Not the same way, but in a consistent way that we have the same program. So a parent aid in Morton County is the same thing as a parent aid in Grand Forks County, as an example. Implementing a caseload formula that allows for a holistic. So I mean, this is where we get to how do we do wraparound services, those type of things. And these are all ideas on how we move these things forward. So it's not like we know that to do a wraparound model we need X, Y, and Z, everybody on call, ready to go. It's how do you have a good case management function, and then that individual knows where to get the resources based on who needs them, whether it's a child, family, or some other subset of those. Because at the end of the day, it's if you just step back and say, okay, why is Chris Jones where he is today? I mean, and you can go all the way back, and it's because, for the most part, I had a healthy upbringing. I had food, I had support, I had housing, I had role models. So, but if one of those things is missing, how do we make sure we get that thing that is missing for that child into that family for them to be successful? So it's not all of those things necessarily. I mean, I know you guys all know this, but I mean, we have to be thinking about the client itself being the number one focus as we move this forward. So from here, I mentioned this earlier, there's National Experts for Work teams. So Kristen Cox, who is, she came in, I think the beginning of the month, and she came and talked to a number of individuals across the counties in the state as it relates to the theory of constraints. She's been the Director of Office and Management and Budget for Utah, I think for the last about 10, 12 years. And Utah used to perform quite poorly as it relates to social service outcomes. Since she's been there, and she would tell you it's not just about her, but they have really reformed their social service delivery model to the point where, like I mentioned earlier, they're focused on intergenerational poverty. So she walked us through the theory of constraint model. She was interviewing us as much as we were interviewing her during this one-day session, and she said, I think you guys are ready. I would like to come and help. So the first two programs that she is coming to look at from a theory of constraints model is CPS investigations and daycare licensing. So what she does is she comes in and maps out the process and looks at all of the different points where work is being done. And because it is such a complex process, it's usually one or two of those process points that things get hung up. And then everybody else is stopping and waiting in order to continue to do their work. So having her come in and say, well, this is, she can speak I would say, government language far better than I can. She's had success with it in Utah, and I mean, she's done these exact same things in social services. So as you know, right now, CPS investigations in the state of North Dakota, 62 days with extensions, right? In Utah, it's 20 days. So they're able to do it in a more effective and efficient manner, and they not only measure their timeliness, they also measure recidivism and other quality measures related to that. So I don't even know if we're measuring recidivism at this point, meaning, you know, if we have a CPS investigation, how many other times do we go back? So it's not just about the CPS investigation itself. It's like, do the CPS investigation, do they need services? What kind of service do they need? They get them in, and then they say, okay, were we successful? Right now, I don't know that we know if we're successful or not. On an individual basis, I'm sure we do, but at a statewide level, how do we, I mean, if nothing else, how do we make the case that we can save the taxpayer dollars in front of the legislature unless we have the numbers to show them? And if we say we're putting this amount of resource here and we're taking away by not having, you know, foster care placements out here. Makes sense? I mean, it's really, it's that cost benefit. I mean, it's always, we need more for prevention, we need more for prevention, we know prevention works, but we're never either able to articulate or show that we're reducing the number of kids in foster care, because we all know that's one of the most expensive places for kids to be. The parent aid, family team decision making, all of those things that could be happening on the front end are going to reduce foster care placements on the back end. Where appropriate, we're bringing in the voice of the customer, so clients that come in. You know, one of the examples, I think it was in eligibility, I think, you know, the example was, should we have a call center for Medicaid? You know, one number for all Medicaid clients to call. And everyone's like, well, that doesn't work. I need to know who my customer is, and they have a relationship with me, and they shouldn't have to be sitting on hold, which I think is a good thing. People shouldn't have to sit on hold. But then it was, well, they leave you a message. How long, you know, do you have to get back to them? Well, 3 days. Well, that seems like a really long time. And then you even step back even further, and you go, well, depending on what kind of Medicaid I have, you may have to call a different person. And it's really confusing. And so my example is, I have a son on Medicaid. We get letters that have my name on the letterhead, and I have no idea what it says. And it says, you're not eligible, or you need to do this or this. And then my wife will say, hey, Chris, what do I do? I don't know. Who do I call? I'm not sure. I mean, those are the things that we're really trying to make more clear. I mean, if you think about the clients we serve, they have less ability to really understand how our system works. And if we don't understand how our system works, how can we expect anyone else to understand how our system works? For those of us that have ND-PERS, there's one number on your insurance card, right? You know, I mean, you know who to call. We don't have that. And it's not a fault of anybody in this room or anybody in Medicaid or anybody in the state. It's just the process that's evolved over time. And then discussions about structure. So I'll talk about that here in a minute. So hopefully you've heard me talk about the focus has not been about counties versus state. It's how do we look at the services that need to be delivered, and how do we deliver them more efficiently and effectively for the client. And if we do a better job for the client, we will save taxpayer dollars. So even if you, I would say for those of us that are heartless, which there's probably nobody in this room, but there may be some people that are, we can show that we will save taxpayer dollars by doing the right thing. And then if we are able to redesign this appropriately and over time, I mean, again, for anybody that thinks this is going to happen overnight, I apologize, it's not. This is going to be an ongoing process for many, many, many years. This isn't a one-time event. But if, I'm guessing for social workers, you didn't get into social work to do paperwork and check boxes and follow up with other social workers or follow up with the state to do your job. You did it because you wanted to provide care to children and families, or who else? So that's really been the key focus moving this forward. And another key point is we're not trying to reduce the number of access points. So at the end of the day, it's not about how do we consolidate in such a way that there's fewer access points. Now that being said, we don't necessarily need the same roles at every access point given on where the client lives. So where there is less population, how do we make sure that people have someone there who cares for them and can help them get access to who they need when they need it? The other thing that we've spent a fair amount of time talking about, not only in social service redesign, but also in the behavioral health assessment across the state, is what do those access points really need to be? So, I mean, yes, we need access points around the county itself, but we also need them in schools. We also need them in jails. It would also be nice if we had them in public health instead of saying someone who walks into public health. It would be nice if they could be identified and provided information and start to enroll in services as appropriate. Same thing with the schools. As a side note, I was just in North Carolina with DPI, where they have what's called community in schools, where they have those wraparound services in those schools. They are doing the targeted case management for those children in those schools that not only are not, they're working with those children, but they're also working with the family. It just so happens that the access point is the school. So we need to find a way to meet people where they are instead of asking them to come to us and understand how we work. But here's probably what everyone wants to talk about, right? So we're getting to the point where we have to talk about structure. And it's structure as it relates to the client. And so this is not just about county employees becoming state employees. This is how do we look at the services that are delivered and what's the best structure to do it. And I would also say it isn't a one-size-fits-all. So right now, if you think about it, we have state supervised, county administered for all social services regardless of what is needed. Well, so back to the subsidized adoption. If you're only doing 1 or 2 subsidized adoption every 2 or 3 years, you're spending more time trying to figure out how to do it than actually doing it itself. If you're doing long-term care Medicaid eligibility for someone who has really complicated oil trusts, you're spending more time on the state trying to figure out what you're doing, where there's actual people who do them all the time and could do it in an hour instead of you taking 3 weeks. And it's not because, again, it's just the process itself. It's the example of going to a hospital. There's, what is there, 40, say there's 45 hospitals in the state. There's probably only 5 or 6 of them you'd go to have heart surgery at, right? And it's not because they're better hospitals necessarily. It's because they have people who do them over and over and over again and can be good at them. Just like probably a better example, there's very few hospitals in the state anymore that deliver babies. It's not because they're bad hospitals. It's because they can't keep their skills up because they're not delivering enough babies. So really, that's what we're trying to get at. It doesn't mean we're limiting access points. It means we're making sure that people can do their job as effectively and efficiently as possible. And there's a lot of anxiety, and I get it. I don't know what to tell you and how to reduce that anxiety. I mean, everybody, you know, one of the common sayings is, you know, people say, I like change as long as it doesn't happen to me. But there likely will be change. And even if we come up with the best model that we all love 100%, that doesn't mean the legislature is going to like it either. So there's, I mean, unfortunately, there's even a higher level or even greater uncertainty as we go through this. But I think where we can rally behind most of this is, do we believe that we're trying to do something better for the client, and how do we keep, pushing that rock uphill instead of talking about what the structure is or what the funding is. But with any change, I just need to say this, there may be unintended consequences. So even when Kristen Cox was here from Utah, when they would go through some of these changes, they would see an initial dip in performance as it relates to serving whatever they were working on because it was a change. And so if there's, I shouldn't say if, when we do have changes in any of these areas, there will be unintended consequences, and we can't say, oh, see, it didn't work. We have to let it build back up. Because even with, for those that aren't aware, the DD payment system that the state has been working on for a long time, finally got to a point we said, okay, we're going to do it. There's still a couple unintended consequences that happened, but it is still the vast majority. To put it this way, we didn't reduce the spending as it relates to what we provide for individuals with developmental disabilities. Now, there's some individuals who had their services reduced, but there's other individuals who had their services increased. And no one wants to talk about the ones that were increased. It's all about the ones that were reduced. And the way our system previously worked, it was far more subjective than it is today. So in other words, I'm not saying that this is the case 100%, but if you were an individual with a developmental disability who had a very strong family support network, you probably got more services than that individual who did not, because they didn't have anyone advocating for themselves. So as we think about these things, I mean, that's what we're really trying to do. We have to make these changes so that those, I mean, if you look at the mission of DHS, it's to serve the poor and the vulnerable. So how do we do that? And we have to be their advocates as well. And then I think, like I said earlier, this is not a one biennium project. So if this will probably be one of the larger changes, I personally hope, as it relates to creating that foundation. But it's not like, let's just say we had the perfect model and we said, we're done. We're going to keep working because we want to, the next thing, how do we reduce intergenerational poverty? How do we, the other thing, I don't want to sound like I'm in love with Utah, but Utah also has zero homeless. They have completely eradicated homelessness in Utah. There's no reason why we can't do that if we do a better job of allocating resources. And granted, Utah is a larger state, but at the end of the day, all their population is concentrated around Salt Lake City. The rest of Utah is rural, and it's a conservative state. So they've figured out how to do it. They're pretty much beating us in every metric as it relates to social services. So how do we all work together to do the same thing? So with that, are there any questions?
So you keep referring back to EMR and the system and Catholic Health Initiative. And my question to you is, our greater IT system and getting implicated, are you looking forward to putting the CHI model into like the EPIC system and bringing that into us and bringing that down? Like,
Absolutely not.
Because that was a nightmare.
Yeah, no, absolutely not. So,
I don't ever want to see it.
so
And I don't want to go through that process again.
yeah, so I'll just give you some numbers just to kind of put them in perspective. There's a whole bunch else that goes with the CHI system, but that was $36 million. Right now, our eligibility system just hit $150 million. So I mean, that's not a good thing. The number of interfaces for EPIC was close to 180, I believe.
That wasn't even CHI, what was bought from CHI for St. Alexis wasn't even ours.
Well, yeah, it was, yeah. I can talk to you offline and give you some more detail, but the eligibility system has probably 30 interfaces. So I'm just, and it's the system that we're putting in is better than the one that we had. So don't, I mean, that is the goal. I don't want to minimize that. But the processes that, but, yep, but the processes are built on the way we're currently structured today. So, you know, you usually want to build an IT system once you have your processes on the front end done, and then build the IT process after the fact. So that's really kind of my example. Yeah. No, I don't mean to frighten. Intentionally. Any other questions? There's got to be some more. Come on.
Well, I think a lot of the questions that everybody has are already the things that you said you can't answer, like structure.
Mm-hmm. So, structure-wise, I think, so when we think about structure, obviously there's the state employment question, right? So how about I go about it this way? What would concern people if they became a state employee? What would concern them? Okay. So as we've looked at those things, for instance, the admin committee itself is, I would say, there is no intention of reducing anybody's pay. And if we looked at benefits, the benefits would be whatever the state benefits are, which, as I understand it, is at least comparable with most counties. I mean, I'm sure there's some changes, but I mean, it's mostly comparable. I mean, unless there's something that I'm not aware of, and if there is, you know, tell me now.
I went from a state job to a federal job and I lost my years going there. So if we do this again, do I lose my years again?
I don't know, but I will find out because
I'm getting too old to
lose your years.
I'm losing my years, and I lost my job because of budget at the state level. So everything you're saying is frightening me.
Yeah. No, and I'm
To a better place.
yeah. No, and I'm not trying to intentionally frighten you. I mean, but I want to be able to tell you what's being thought about and discussed. I mean, it's not meant to be a secret. But it's my understanding, I believe, like, for instance, when child support came, people kept their years of service. So.
How about positions? Like, are you, like, when you talk about benefits and stuff, are they looking at keeping, like, positions or cutting them, or?
Right now, I think the way, we haven't gotten that far down, so that being said. Now, do we have all the right roles? Probably not. You know, we need different roles. Now, there hasn't been talk about eliminating positions, but, you know, if you take the fact that we have a lot of people working, we have more people working on the back end than the front end. So how do we start to transition people, if that's the way we go, to doing those things in the front end and working with families instead of on the back end? So there has been no, I mean, when we're looking at this, as far as I'm aware, and Tim's on the admin committee, I don't think there's ever been talk about eliminating positions.
So then with that, are we gonna have to reapply for our position?
Oh.
Or are they going to just redesignate it and give us a different title? Or do we or something like that?
We haven't even gotten that, I mean, into that level of detail. And, you know, if in a perfect world, as I've talked to legislators and how this would work, is it would be something that, so if, like, let's say we just said, you know, sub-adopt Medicaid eligibility and something else we wanted to do across the state the same way through a unification type of thing. It wouldn't be then on day one, it would just happen. It would be, how do we work through the process to do it? You know, where are these individuals at? There's no, I think the other thing, and this has been pretty interesting, and I can tell you where the governor's office is because it's the same place I am. There's a lot of things that we do that we could do across the state that don't require people to move to. So if we have, so for instance, let's use that Medicaid eligibility for long-term care for people with oil trusts. It may be that those individuals live in Williams County or Mountrail County because they've already got the expertise and they're closer to it. They can, so when someone shows up in Richland County down in southeastern North Dakota, that southeastern, they still come in, but then it gets transferred to that eligibility worker there. But in terms of the HR process that we would go through, I really have no idea. Because we're not, I mean, we haven't even gotten close to that point yet. So. Any other questions?
Chris, would you expect anything that you're talking about meeting legislation goals? Would anything you'd be doing require further legislation to be approved?
Good point. Thank you. So it's not just this structure, this redesign that will require legislation. We also expect there's things that are in law or in rule that would need to be changed in order to be more efficient and effective. So it will so for those that are familiar with the Justice Reinvestment, everybody thinks about the $7 million that was pushed upstream, but there was also multiple bills that were passed in order to allow that to happen, in order to better serve those individuals who are coming out of the prison system. So it's multiple things, and even from an unintended consequences perspective, we could come up with some of the greatest things and then realize, oh, we missed that rule or law, and we're going to have to either wait a session or go through another process. So again, it's not going to be this nice, clean cut process where it all makes sense. But I think what I think you need to take home and think about is where we're going and why we're doing what we're doing, and having an opportunity to improve in those areas where you serve clients. I think that's our ultimate goal. That's what we're trying to focus on. Because I don't think there's anybody who really enjoys, gets greater enjoyment from the process that they go through today than serving the clients themselves. And so what do we need to do to improve that?
So who is on the front end doing that? I'm in eligibility.
Mm-hmm.
And this may sound strange to everyone. I'm less concerned about structure and more concerned about upfront prevention and education. I feel like an enabler 80% of the time.
Mm-hmm.
So who's on the committees? Who's getting input from us who are doing this?
Well, I could certainly get the list of people who have been working on it so far, but it's kind of like this is such a big process because there's so many individuals involved. How do you kind of walk it forward and build that momentum going forward? Because when we get to what you're talking about, once we understand and can get comfortable with where we're going and then make those structure changes we need to make, then we continue to do that work that you just mentioned going forward. Because, I mean, it's that hard to do. And it doesn't happen overnight. And the other unfortunate thing is, well, it's unfortunate, but it can be great, is the things that we're doing are generational. And so it's going to take generations for some of these returns to come back. And so how do we keep primarily the legislature on board saying, this is why we're doing it, here's why we do it. Because at the end of the day, we would be spending more on prevention and early intervention if we could see far enough down the road. Because the data is out there to suggest it does save money. So how do we take the resources we have and try to balance them more going forward instead of trying to balance them within law? How do we balance them as a team instead of try to balancing them within law? That's really what we're trying to get to. So.
I think it's really good about the generational thing, that is the key.
I do think, you know, the legislature wants to see us all come and say, we feel like we can make a difference. Here are the big things we want to do. You know, I think in the past, it's been, we need more money, caseloads are going up, but it's my understanding, and people tell me if I'm wrong, because I'm new, but it's rare that we said, well, this is what we spent on the front end, look at the money we saved you. And even if we did do that, there's the fear, well, if we save the money, then they're going to take it away. So how do we come about this and say, well, here's the money that we've allocated to you in the past. Here's what we, as the social services team, here's how we're willing to move it around. Let us show you what we can do, and then go forward from there.